Welcome back to the deep dive. Today, we're tackling something that, honestly, most of us hope we never face, but probably should be ready for. Being right there when an emergency happens, that moment of shock. We're going to try and take all that chaos and adrenaline and sort of distill it down into a clear, actionable plan. Really just three main steps.
Yeah, our sources lay out this fantastic roadmap, actually. It's designed to help you push past that, initial panic and become someone who can actually help in those first vital minutes. Because when someone gets hurt or suddenly falls ill, what a bystander does or doesn't do can make a huge difference. We're focusing on four key things you really need to, nail. First, just seeing that it is an emergency. Second, making that conscious choice to step up and act. Third, getting professional help on the way activating EMS, the 911 call. And finally, giving the care you can give based on your training until help arrives.
And that second point, deciding to act, that's often the biggest hurdle, isn't it? It's profound. When we break down the actual steps, we're basically giving your brain a framework, something to grab onto instead of just freezing. It's like replacing that feeling of, oh no, what do I do? With, okay, step one is, preparation really helps manage that adrenaline surge.
Can you believe they're catching the game last night?
It was amazing. I thought it was over. I was ready to turn the TV off and go to bed.
Yeah, but they got lucky. They had no business winning that game.
Look, a win is a win.
Yeah, right. Oh, check him out. That guy looks like he was out on the field.
Seriously, though, you think he's okay?
I would assume so since he's out and about, but how can you tell? Hello? I gotta get to the office.
Yeah, me too.
Yeah. Okay. I'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Help! Please. Dad, are you okay? Help! Dad, someone help my dad, please.
Sir, are you okay? Sir, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have this at the store.
Okay.
Dad!
It's okay. He's calling 911. Did your father complain about anything before he collapsed, or?
He was complaining about not feeling well, but he always complains, and then he just collapsed out of nowhere.
Do you know if he's allergic to anything?
Allergies... Aspirin. He's allergic to aspirin.
Does he take any medication, or?
I don't think so.
Okay, let's start right there. Step one, recognizing there is an emergency. Our sources talk about using your senses, almost like alarm bells going off. We tune out so much normally. What are those specific signals, things that should make us stop and think, wait, this isn't right?
Exactly. It's all about the unusual, things that break the pattern. So unusual noises may be a loud crash, breaking glass, or even sudden silence when there should be noise. Unusual sights, smoke, fire, spilled chemicals, someone lying on the ground. Unusual odors like gas, strong chemicals, something burning that shouldn't be. And maybe most importantly, unusual appearances or behaviors in people. Someone clutching their chest, slurring their words, looking pale and sweaty, or acting really disoriented.
Right, so if something looks, sounds, or smells off, assume it's an emergency until you know otherwise. Don't just dismiss it.
That's the key takeaway.
Yeah.
Trust those instincts.
But this is where that hesitation often kicks in, right? People think, oh, I'm not a doctor, I can't possibly help. But being a bystander doesn't just mean doing CPR, does it? There are other roles.
Oh, absolutely. Being helpful takes many forms. Yes, someone might give basic first aid, but the person who calls 911 clearly and calmly, that's crucial. Or the person who runs to get the AED or the first aid kit from the wall, also vital. Sometimes the most effective thing you can do is direct other people. You call 911, you go find a kit.
Yeah.
That kind of delegation is powerful.
Okay, let's tackle that hesitation head on, though, because that feels like the core issue for a lot of people. Why do we freeze? Fear must be huge.
It is, definitely. Fear of doing something wrong, maybe making the injury worse. There's also just plain uncertainty, like, is this really an emergency? Am I overreacting? People worry about looking foolish. And then there's the whole social dynamic, the bystander effect. If other people are around, you might think, oh, they've got it covered, or someone else here must know more than I do.
Yeah, assuming the situation's under control when it might not be.
Right. Plus, let's be honest, some things are just unpleasant. Squeamishness about blood or injury is real, and people worry about catching a disease, too. That's a valid concern in their minds.
And the big one, getting sued. Try to help, something goes wrong, and suddenly you're in legal trouble. That thought alone could stop anyone.
It definitely could, and this is where the Good Samaritan laws are so important. They exist specifically to address that fear. Basically, these laws protect people who step up, voluntarily give care in good faith, and don't expect or accept anything in return. Like, you're not charging them for your help.
So the law is trying to encourage people to act.
Exactly. The intention is to remove that fear of legal consequences so you feel more confident jumping in. And actually, lawsuits against lay responders who act reasonably are incredibly rare.
Okay, that's reassuring. What about the fear of infection? How realistic is that risk?
The actual risk of catching something serious while giving basic first aid is very, very low, especially if you can take simple precautions. Using personal protective equipment, PPE like gloves, if they're available, is always best practice. Maybe the breathing barrier for CPR if you have one.
But if you don't have gloves?
The guidance is generally that the immediate need to help, especially for something life-threatening like severe bleeding or CPR, outweighs that minimal risk. You can wash your hands thoroughly afterwards.
Okay, so get past the hesitation, know you're likely protected, the risk is low. Now what? Let's get into that structure. Check call care. Starting with check. This isn't just a casual glance around, is it? It's more systematic.
Right.
Now that you have recognized an emergency and decided to take action, follow the emergency action steps. Check, call, care. Before rushing to help an injured or ill person, you need to check the scene, so stop and look around. By answering the following questions, you will gain the information you need to proceed. Is the scene safe to enter? Hazards such as fire, spilled chemicals, and traffic, to name a few, could endanger you or any bystanders. If the scene looks unsafe, stay clear and call 911 or the designated emergency number. What happened? Check for clues that might tell you the cause of the emergency. How many people are involved? In an emergency with more than one injured or ill person, you may need to prioritize care. What is going on with the person? Form an initial impression about the nature of the person's illness or injury. If you see severe, life-threatening bleeding, take action to control the bleeding using any available resources. Is anyone else available to help? Bystanders may be able to provide valuable information about the situation or the person, along with getting needed items, controlling crowds, and reassuring the injured or ill person. Once you've checked the scene, you need to check the person. If you are not sure whether a person is unresponsive, shout using the person's name if you know it. If there is no response, tap the person's shoulder and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. If there is no response and the person is not breathing or is only gasping, the person needs help right away. This brings us to the second emergency action step. Call. Unresponsiveness, trouble breathing, and severe bleeding are all signs of a life-threatening emergency. If your initial check reveals these or any other life-threatening conditions, make sure that someone calls 911 or the designated emergency number right away. The final emergency action step is to give care according to the conditions that you find and your level of knowledge and training. Always remember, check, call, care, and you'll be ready to respond to any emergency.
The absolute first thing you check is scene safety. For you, is there oncoming traffic? Is there a fire? Spilled power lines? An unstable structure? Anything that could hurt you if you rush in?
So if the scene's dangerous?
Don't go in. Or if you can, try to make it safe first, or move the person if it's safe to do so. But your safety comes first. Otherwise, call 911 and wait for professionals with the right gear.
Okay, scene safe. Now what am I checking?
Now you do a quick assessment. What might have happened? How many people are involved? What's the person's general condition? Are they moving? Awake? bleeding badly, you're forming that quick initial impression, is this likely life-threatening or not?
Got it. It leads directly into call, assuming you found an emergency, activating EMS. Why is that call so time critical?
Because for many serious conditions, think cardiac arrest, stroke, major trauma, getting advanced medical care quickly makes a massive difference in survival and recovery. Every minute counts, especially for something like needing defibrillation. That survival rate drops fast.
Okay, here's something you mentioned earlier, delegating the call. My gut reaction might be to whip out my own phone. Why is sending someone else often better, if possible?
It's about efficiency, really. If you have other bystanders, sending one specific person, you in the blue shirt, call 911 now, frees you up to immediately start care.
Ah, so you don't waste those seconds making the call when you could be, say, applying pressure to a bleed.
Precisely. While they're on the phone, you're already intervening. If you're totally alone, of course, you have to make the call yourself. But delegation is key when you can.
And when someone is making that call, or if I have to make it, what absolutely needs to be communicated to the dispatcher, besides the basic?
Location, location, location. And be specific, not just the street address. Give the nearest cross street or landmark. If you're in a big building, say which floor, which room number, or area 3rd floor by the west elevators, they need to find you fast.
Okay, so exact location is number 1.
Yep. Then the phone number you're calling from, just in case you get cut off. What the emergency actually is, someone collapsed, there was a car crash, how many people are hurt, and importantly, what care is already being given. We've started CPR, or we're controlling the bleeding.
And the golden rule.
Don't hang up. Stay on the line until the dispatcher tells you it's okay. They might have instructions for you, like how to do CPR or control bleeding. They're a resource, too.
Right. So what are the absolute red flags? The signs that mean call 911 immediately, no hesitation.
Okay, the big ones. Anyone who is unresponsive, doesn't react when you talk to them or tap them. Breathing problems, either not breathing at all or struggling to breathe. Making weird noises, breathing really shallowly or quickly. Severe bleeding that you can't easily control.
Okay.
Signs of a heart attack, like chest pain spreading to the arm or jaw, sweating, nausea. Or signs of a stroke, sudden weakness on one side, facial droop, slurred speech. Also severe burns, obvious serious injuries to the head, neck, or back, suspected poisoning or seizures, especially if they're first one or last a long time.
That's a clear list. If you see any of those, the call is the priority.
Yes, activate EMS right away.
This brings us to a really important distinction, especially if you are alone. Call first versus care first. It sounds a bit confusing. Can you break that down?
Yeah, this is probably the most nuanced part, but it makes sense when you think about the likely cause of the problem.
Yeah.
You call first, meaning call 911 before starting care, mostly for situations where the heart likely stops suddenly, and defibrillation is the most critical need.
Okay, like cardiac arrest.
Exactly. So that applies to any adult or adolescent, say, 12 years or older, who you find unresponsive. It also applies to a child or infant who you actually saw suddenly collapse. That suddenness suggests a possible cardiac cause, or an unresponsive child or infant who you know has existing heart problems. In these cases, getting the AED and advanced help on the way ASAP is paramount. So call first.
Okay, that makes sense. Call first for likely cardiac issues. So when do you do care first?
You prioritize care first, meaning give about 2 minutes of care before stopping to call 911 for situations where the problem is more likely related to breathing, to oxygen deprivation.
Ah, okay. Like
Right.
what?
The classic example is an unresponsive child or infant who you did not see collapse. You just find them unresponsive. The assumption there is that they probably stopped breathing first, maybe due to drowning, choking, or some illness, and then their heart stopped. So giving them breaths and compressions right away for 2 minutes might be crucial.
So give 2 minutes of CPR, then call.
Yes, if you're alone. Other care first situations include someone who is obviously choking, someone having a severe allergic reaction, anaphylaxis, who might need help with an EpiPen, or someone with life-threatening bleeding that needs immediate pressure.
Because those need hands-on intervention right now.
Exactly. The immediate care is the most critical thing in those first 2 minutes. Then you call.
That clarifies it beautifully. Call first for sudden collapse-known heart issues, care first for likely breathing issues, or things needing immediate physical intervention like choking or bleeding.
You got it.
All right, let's move fully into care. We've checked, we've called, or decided to care first. Before we touch someone, though, there's consent. That feels really important, legally and ethically.
Absolutely essential if the person is conscious and able to respond. You need to get their permission. Introduce yourself. Hi, my name is your name. I know first aid. State what you think is wrong. It looks like you've hurt your arm. And ask, is it okay if I help you?
And if it's a child?
You need to get consent from a parent or guardian if they are present.
What if the parent isn't there, but the child needs help?
If the parent isn't available and it's a life-threatening situation, consent is generally implied, similar to an unresponsive adult. You act in the child's best interest.
Okay, so what if they're conscious, but they say, no, don't touch me?
You have to respect that. You cannot force care on a conscious, mentally competent adult who refuses it.
But what if they clearly need help? Do I just walk away?
You don't provide hands-on care, but you should still call 911 for them. Let the professionals arrive and assess the situation. Your role then might just be to observe and report what you saw.
And if they're unresponsive, passed out?
Then consent is implied. The law assumes that a reasonable person would want help in a life-threatening situation if they were able to ask for it. So you can proceed with care.
Okay, consent sorted. Now, if the person is responsive, conscious, talking maybe, how do we figure out what's going on efficiently? Our sources mention the SAMPLE mnemonic.
Yes. SAMPLE is a fantastic tool for interviewing the person or bystanders. It gives you, and eventually EMS, crucial background info.
Let's break it down. S.
S is for signs and symptoms. Signs are things you can see, like bleeding or swelling. Symptoms are things they feel, like pain, nausea, dizziness. So you ask, what do you feel? Where does it hurt? A is for allergies. Are you allergic to any medications, food, insects, anything? Really important if paramedics need to give medication later. M's for medications. Are you taking any prescription or over-the-counter medications? Knowing what they take can give clues about underlying conditions. P is pertinent medical history. Do you have any medical conditions I should know about, like diabetes, epilepsy, heart problems, asthma? L is last food or drink. When was the last time you had anything to eat or drink? This matters if they might need surgery later.
And E.
E is events leading up to the incident. What were you doing just before this happened? Did they feel dizzy before falling? Did they get hit? This helps piece together the cause.
That's a really thorough checklist disguised as a simple word, SAMPLE.
It covers the key information quickly.
Okay, after SAMPLE for a responsive person, we might do a head-to-toe check, gently looking for injuries.
Right. If they have pain or you suspect an injury, you do a careful check. Look and gently feel, starting at the head and moving down. You're looking for things like cuts, bruises, bumps, swelling, deformities. Check their skin. Is it unusually pale, flushed, or sweaty? Cool or hot? Ask them not to move any part that hurts. Look for medical ID tags like a bracelet or necklace. Just be systematic and gentle.
Got it.
If your initial check of a person reveals that she is responsive and awake, get consent to provide care. If she does not have any life-threatening conditions, gather additional information by asking questions and performing a head-to-toe check. Begin by interviewing the person, or if necessary, any bystanders. Use the mnemonic sample as a tool to remember the interview questions.
So what's going on? Are you in pain?
My arm really hurts. I tripped and fell.
Okay. How are you feeling otherwise? Do you have pain anywhere else? Any shortness of breath, chest pain, or dizziness?
No.
Okay. Let me ask you a few more questions,
Okay.
and then we'll take a look at that arm. Is that okay?
Mm-hmm.
Are you allergic to anything?
Penicillin?
Okay. And what happens when you take penicillin? Have you ever had a severe reaction to it?
No, just a mild rash.
Okay. Are you taking any medications currently?
I'm on blood pressure medication.
And when did you take it last?
This morning.
So do you have any other medical conditions?
No.
When was the last time you had anything to eat or drink?
This morning, a bowl of cereal for breakfast. It's a couple hours ago.
So tell me what happened right before you hurt your arm.
I was going to lunch, and I tripped over a crack in the sidewalk. I'm just so clumsy.
I've done the same myself. Don't worry about it. And did you hit your head when you fell?
No.
Okay, that's good.
Once you've asked the person these questions, look at and gently feel each part of the body from head to toe, checking for signs of injury or illness.
Okay, I'm going to check you now for any other injuries. Do you mind if I touch you?
I don't mind.
Okay, I'm going to start with your head first. I'm going to take a look first. Okay. Does this hurt?
No.
And this?
Mm-mm.
Okay. Now take a deep breath for me. And breathe out. Does it hurt to take a breath?
No, it doesn't.
Okay. And are you having any stomach pain?
No.
And are you having any hip pain at all?
None.
Okay, that's good. I'm going to take a look at your leg now, okay?
Okay.
Does this hurt?
No.
And this? Ooh, it looks like you have a bruise there. We'll take care of that too, okay?
Okay.
And can you wiggle your toes for me? Are you in pain?
No.
Okay, good. Does that hurt?
No.
How about this?
Doesn't hurt.
And can you wiggle your toes for me over here? Any pain?
No pain.
Good. I'm going to feel your arm now, okay?
Okay.
Does this hurt?
No.
And this?
No.
Can you wiggle your fingers for me? Good. Okay, I'm going to feel your injured arm now, but I won't touch the bruised area, okay?
Okay.
Does this hurt?
No, it doesn't.
And this?
Nope.
And can you wiggle your fingers for me? Good. Are you having any back pain?
None.
Good. Let's take care of those bruises now, okay?
Okay.
Once you've completed a physical check of the body, provide care for any conditions you find. If necessary, send someone to call 911.
Now let's contrast that with checking someone who is unresponsive. Time is way more critical here. We need to know if they're breathing fast.
Absolutely. First, try to wake them. Shout, using their name if you know it, "Are you okay?" Then, tap firmly on the shoulder for an adult or child, or flick the bottom of the foot for an infant.
If they don't respond.
Then you immediately check for normal breathing. Kneel beside them, tilt their head back slightly to open the airway, and look, listen, and feel for breathing.
But only for...
No more than 5 to 10 seconds,
Yeah.
max.
Why so quick?
Because if they aren't breathing normally, you need to start CPR immediately. Every second counts. We can't waste time trying to decide if they're breathing or not. 10 seconds is enough.
And what about gasping? Sometimes people make weird gasping sounds.
That is not normal breathing. Agonal gasps, those isolated, infrequent gasps, are a sign of cardiac arrest. If you see or hear that, you treat it as not breathing and start CPR or use an AED.
Okay, crucial distinction. Gasping equals not breathing normally.
Correct.
So if they are unresponsive and not breathing normally or only gasping, what's the immediate next step?
Have someone call 911 and get an AED if available. Make sure the person is lying face up on a firm, flat surface. And begin CPR immediately, starting with chest compressions. If an AED arrives, use it as soon as possible.
Okay. But what if they are unresponsive, but after that 5-10 second check, you determine they are breathing normally?
Okay. Different path.
Yeah.
They're unresponsive, but breathing. We still need to protect them. If someone else is there, send them to call 911 and get an AED, just in case. Try to get that SAMPLE info from bystanders if possible. Do a quick head-to-toe check for obvious injuries. And then the key step is to put them in the recovery position.
The safe roll, right? Why is that position so important?
It helps keep their airway open because gravity helps the tongue fall forward, not back into the throat. And it allows any fluids like saliva or vomit to drain out of their mouth instead of going into their lungs. Prevents choking or aspiration.
How do we do it properly? Quick guide.
Sure. Kneel beside the person. Take the arm closest to you and extend it straight up above their head, alongside their ear.
Okay, arm straight up.
Then take their other arm and bring it across their chest. Grab their leg that's farther away from you, just above the knee, and bend it up so the foot is flat on the floor. Now gently pull on that bent knee and roll them towards you, onto their side. Their head should naturally rest on that extended arm you put up first.
And the legs?
Adjust the top leg so both the hip and knee are bent at roughly right angles. This keeps them stable on their side, prevents them rolling onto their face or back.
Got it. Arm up, roll towards you, bend the knees for stability, keeps the airway open and safe.
That's the essence of it. Simple, but really effective for an unresponsive person who is breathing. You know, when you look back at all these steps, the consent, SAMPLE, call first, care first, recovery position, it seems like a lot, but what we're really doing is taking that overwhelming, chaotic feeling of an emergency and breaking it down into manageable chunks, specific things you can do. It shifts your mindset from frozen by fear to focused on the next step. That call first versus care first decision, for example, that's high-level critical thinking, right there in the moment, based on understanding the why behind the potential problem.
It really reframes it from panic to procedure, turning chaos into action. And that actually leads perfectly into our final thought for you, the listener. Now that you understand that crucial difference between call first and care first, picture this. You walk into a room and find an infant, motionless, clearly not breathing. But you didn't see what happened, you just found them like this. Based on what we just discussed, what's the very first action you would prioritize for those initial 2 minutes before you step away to call 911? Think about the likely cause in that scenario. That knowledge, that ability to decide and act is now part of your toolkit. Thanks for joining us for this deep dive.